Welcome. I'm Dr. Achina Stein, and this is the What If It's Not Depression podcast. And today we are going to talk to Dr. Ryan Worley, who is a functional neurologist, and he is going to tell us all about the vestibular system. It is a part of the brain that can actually mimic or contribute to depression. It's called vestibular dysfunction. So welcome, Dr. Worley.
Hey, thank you for having me.
Yeah, and hey, if you want to learn more, please click on the like button and subscribe. There's many other podcasts for you to view, and this is just going to be one of them. Dr. Ryan Worley is a functional neurologist and the founder of NeuroBalance Solutions. It's a brain-based rehab clinic in Utah. He specializes in helping patients recover from concussions, dizziness, and other neurological dysfunctions that don't always show up on imaging. Through advanced testing like videonystagmography and posturography, really big words that are hard to pronounce, Dr. Ryan identifies subtle imbalances in the brain and nervous system, then builds personalized rehab strategies that reconnect brain and body. His passion is making complex neurology approachable and helping people to give their lives back when standard care hasn't worked. And I'm assuming that it even includes people who have had symptoms like a Parkinson's disease, but not, maybe early symptoms of Parkinson's disease, but not actually given that diagnosis. Am I right?
Absolutely, yeah.
Yeah. So I actually saw a patient recently who had tremors and he had negative MRI and but there's many root causes to that, and it would be great to do a deep dive, including that as well.
Mm-hmm.
Yeah. So, Dr. Ryan, how did you get involved in functional neurology? What brought you to this field?
So I think the best way to kind of tell how I got into it is to kind of tell my story. So basically, what happened was I was living in Vegas for a little bit. Kind of, this was during COVID. And I had a roommate who we were both like into bodybuilding. We were both healthy, things like that. He ended up getting sick. It wasn't COVID, but he ended up getting sick, and I didn't hear from him for a while. So I ended up going to check on him, and I found him dead in his room.
Oof.
And ever since then, I had panic attacks. I had depression, anxiety, chronic stress, dizziness, you name it, I had it. And I realized what happened was during that time or that trauma, it was revealing all the dysfunction that I had in my brain from the concussions that I had from growing up. Because I played rugby. I had a very active childhood. I know of a couple concussions that I actually had. That was like the root cause, but my brain was so good at suppressing any of those symptoms that it took this trauma, this emotional trauma, that made me hyper aware of all these things. And so I basically I didn't want to get on a bunch of medications. I tried everything as naturally as possible. I literally would look in the mirror and smile at myself and tell myself, everything's okay, you're safe, just trying to convince myself that I'm okay. And I tried meditation. I tried, talk therapy. I read so many books. I did all these things and nothing really seemed to work until I met up with my now mentor who literally does functional neurology. And we ran through my VNG, the videonystagmography, recorded my eye movements, and saw all this dysfunction from the concussions that I had growing up. And so, literally, it was like all this dysfunction was now showing me these symptoms.
Mm-hmm.
So, depression, anxiety, like all these things, they're just symptoms of brain dysfunction. And so that's where I differ from the, conventional medicine is I don't chase these symptoms.
Right.
I honestly I don't want to say I don't care about these symptoms, but that's not my focus.
Right.
My focus is to fix the brain pathways and make sure that those are functioning properly. And then everything else, once the brain feels safe, that's where the healing begins.
Right.
And so that's what it took for me. I had to make sure that my brain was functioning the way that it should. So that way my brain could feel calm and safe and I can start healing and not have all these symptoms. So that's kind of how I got into it. Was literally I experienced it myself. And then I decided to go, back to school and learn all this stuff. And I devoted my life to helping people in this way because it is so life altering having these things.
Mhm.
So I'm a chiropractor by trade, and I love the adjustment, but it's so temporary for a lot of people,
Right.
and it's not helping people in the way that I truly want to help people. Like, okay, your back hurts. Oh, that's miserable. Yeah, but it's not as miserable as wanting to, end your life because you're so depressed, or, the
Right.
dizziness, like you can't leave your house because I'm so dizzy, or whatever it may be. And so that's why I really feel like this is my true calling, and that this is what I'm supposed to be doing and how I'm supposed to be helping people.
That's awesome. How long have you been
So
doing functional neurology?
a couple of years now.
A couple years. Awesome.
Yep.
Yeah, I love your Instagram
Thank you.
videos. They're very informative, very
Hmm.
informative. It's a little hard doing some of the exercises. I've tried doing a few of them.
Yeah, some of them are hard. And the thing is, like, the hard part too is because there's so many different pathways that can be dysfunctional and so many ways of fixing those pathways.
Mhm.
However, the exercises that I provide, like on Instagram and things like that, they're very generic exercises because the brain is so specific and you have to be so specific that I can't be giving out. It's irresponsible of me to give out these exercises if it might actually make somebody worse. So
Right.
the ones that I have actually given out are the ones that anybody can do. So I definitely recommend everybody try these exercises, whether it's the alternating finger tapping, the shoot the bunny, things like that. So
Yeah, right, right. Yeah. So let's get down into, into a deeper dive into what you do. So tell me more
sure.
about what this videonystagmography and posturography is.
Yeah. So basically the Videonystagmography, I call it the VNG. Basically, it's a virtual reality goggles that record your eye movements, because
Mm,
your eye movements can actually tell me about every single part of the brain and its function. So I don't actually see the structure, but I can see the function. There's 10 different eye tests in there. The first one being darkness. So in darkness, that's like the number one test that I do, because in darkness, when you have no idea what's up, down, left, right, anything like that, you have nothing to gaze fixate on. That's when I can see so many of these dysfunctions come out. So we might go cross-eyed, which is like a convergence. We might have a drift. We might have what's called square wave jerks, where the eyes are just kind of jerking back and forth. We might have a divergence. It just depends on what the person has going on. And
mm,
then basically, I'm going through each one of the tests, and I'm kind of painting this story. Okay. Um, a lot of it has to do with the vestibular system, even with the eyes. Okay. The vestibular system is part of our balance system. It's located just on the other side of our eardrum. And that plays a role in our balance and how we fight gravity and things like that. So the posturography unit that I use is basically this platform that you stand on, and it measures your sway and how much control do you have. And we do this with the eyes closed, so that way it challenges that system even more.
mhm,
Okay, because when we have our eyes open, that's when we can suppress so many things.
mhm.
But when our eyes are closed, we're not relying on our vision anymore. We're now relying on our vestibular system. And so those are the two tests that I do, and then I do a tapping test as well. That is to a metronome to see how the timing mechanism of your brain is, because so many processes come down to timing, like speech, walking, talking, reading, tons of things like this
Mhm,
rely on a timing mechanism. Okay,
mhm,
and that is going to be the cerebellum as well as the temporal lobe
mhm.
that I'm testing with that one. So literally, with all these different tests, I can see all the different functions of the brain. And then the cool thing is, I can apply an exercise and then retest and see if it made a difference,
Mhm.
because the exercise kind of activates the brain for a short period of time. And as long as I test within that window, I can see if it made you better or not. And if
Mhm.
I do make it better, then that's awesome. That's something that you need to continue to do throughout the day, to kind of hardwire that pathway. Okay. So
Mhm.
if we do it like the first time, like the exercise for the first time, it might last 3 to 5 minutes. Everybody's different, but it might last about 3 to 5 minutes. And then it kind of fades away and goes back to where it was. But then the next time that we do it, it might last 5 to 10 minutes, and then 10 to 15 minutes. So it's a lot of work in the beginning, but then it's to the point where, after about 6 months or so, we don't have to do the exercises anymore because that pathway has been hardwired.
Cool.
So yeah, long answer of that's what the VNG is, and that's how I use it in practice, basically,
Mhm.
and the posturography.
Yeah. So why don't we talk a little bit more about what exactly the vestibular system is? Yeah, because
Absolutely.
there's multiple parts. Yeah, I know you mentioned
Yes.
a couple things like the cerebellum and
Yep. Yep.
yeah.
Yeah. So the vestibular system is, like I said, is part of our balance system. So it's composed of what's called semicircular canals, so little half circles, and there's two that are anterior, meaning that are kind of oriented in the front, and there's two that are horizontal, and then there's two that are posterior.
Mhm.
Okay, so the anterior ones, those are activated when we bring our chin to our chest, and then the right horizontal canal is activated when we turn our head to the right. It's not lateral flexion, it's rotation of the head.
Mhm.
Okay. And then we have our left horizontal canal when we turn our head to the left. And then when we have our head back, we're activating both posterior canals.
Mhm.
Okay.
And these are
I have a
canals in the ears.
correct on the other side of the eardrum, just right on that other side. Yep. And I always like, I have a video where I'm like pointing out the different canals and I'm like, I feel like a flight attendant with it. But anyways, okay. And then we have an otolith on either side, or two otolithic organs. Okay. So that's the utricle and the saccule. The utricle detects motion in the linear plane, okay, in the horizontal plane. And
Mhm.
then the saccule detects motion in the vertical plane. So the utricle, that's like walking, driving in a car, things like that, moving in this plane. Then the saccule is going to be like in an elevator, sitting down, standing up, walking as well, because we're bobbing up and down. And the saccule never shuts off because it's always fighting gravity. Even when we're sitting here right now, and if we're just sitting still, it still gets this constant pull from gravity.
Hmm.
Okay.
Mhm.
So then we have a left side of the cerebellum, a midline cerebellum, and we have a right side of the cerebellum. Okay,
Mhm.
so with the canals that are detecting this, kind of rotation, the otoliths, which is detecting the linear motion, and then the cerebellum, that's 13 total areas. And the problem could literally be in any combination of those areas.
Mhm.
So whenever I see somebody, I'm running through my tests, I'm like, okay, that's a check mark for this area. That's a check mark for this area. It's very rarely just one location, like a left posterior canal issue, you know? So the vestibular system is huge. And like I said, it never shuts off.
Mhm.
So if it's dysfunctional, it literally has connections to the amygdala. And the amygdala is our fight or flight area, which it's sending signals. If it's broken, it is literally sending signals like, hey, there's danger, something's not right. And what's the amygdala supposed to do?
Right.
It's supposed to then, disperse that information everywhere. And that's when we have these symptoms of anxiety, depression, like all these kind of things. And so if we're not treating the root cause, and like I said, you can do all the talk therapy you want in the world, but if it's a vestibular issue like mine was, that is more powerful than just telling yourself, I'm okay, I'm safe, I'm happy,
Mhm.
doing positive affirmations, which I love, but it's not as powerful as a vestibular system that never shuts off.
Right. Right. Yeah. So what you're basically saying is that you are looking for things that are happening upstream that you can fix in the brain
Yes.
specifically that can manifest as symptoms of depression, anxiety, etc., downstream. So for people to know whether or not they might have a vestibular dysfunction, what are some accompanying symptoms that make you think, oh, I wonder if this is the case? I'm imagining dizziness,
Mm-hmm.
tinnitus, uh,
Yeah.
loss of balance are more obvious symptoms. Are there some other symptoms that aren't so obvious?
Yeah, absolutely. So a lot of people, when I tell them, I'm like, when they're like, oh yeah, I have anxiety, depression, or whatever, and I'm like, oh, we got to look at your vestibular system. And even if they know a little bit about the vestibular system, they're like, but I'm not dizzy. That's only one of the symptoms. So you
Mm-hmm.
don't have to have dizziness. Again, these are all symptoms. So it could be the feeling of like impending doom, the what else? Um, Especially people that have tried medications and it's not working, that's definitely when somebody should look at their vestibular system.
Mm-hmm.
Um, just kind of like that uneasy feeling, like I said, that impending doom, just kind of feeling off. It could even be coordination issues. So like, oh, I feel so clumsy, or like I'm always running into the wall, or something like that. That
Mm-hmm.
could definitely be a vestibular or cerebellum issue, or both.
Mm-hmm.
Same thing with like brain fog, concentration issues. This could all be due to the vestibular system, even high blood pressure that you have no explanation for.
Mm-hmm.
Because it's when that vestibular system is off and you feel, like there's danger, what's going to happen? You're stuck in fight or flight. Your blood pressure is going to increase because your brain basically thinks, hey, there's danger. I need to be able to run and, fight whenever I need to. And
Mm-hmm.
so that can kind of be those symptoms as well.
Yeah, I also wonder if you ever have situations where people have chronic nausea, unexplained nausea. It's not the
Mhm.
gut, but there's something else that's kind of making them feel uneasy, almost like they're on a boat, you know?
Yes. Yeah. So there's maldated Barkman syndrome is one of the things that I'll work with, conditions that I'll work with. And that's literally they constantly feel like they're on a boat,
Right. Yes.
and which is just so miserable. And a lot of times when I look at their movements, it's an overactive system. It's an overactive part of it. So it could be an overactive left anterior canal or a right horizontal canal or whatever it may be that's overactive, and giving them this perception of rotation and movement when they're not. And so it could be a car that's driving by or people like crowds that literally it's so stimulating because it's overactive that they just feel so off from that.
Right. Right. Right.
So, yeah,
I would imagine that lights bother them, just like migraine headaches. It might
yep,
even trigger migraines, right? Or headaches.
absolutely. Yeah, absolutely.
Yeah.
Especially because your vestibular system has connections to your skeletal muscles too.
Mhm.
So if your vestibular system is, broken, what's going to happen is if your brain doesn't feel stable, it's going to tighten your neck musculature, your back, your hamstrings, everything like that.
Mhm.
For example, I had a overactive left posterior canal. That was one of my main issues. What
Mhm.
happened was my musculature, I would always get these knots on my left scalenes, my SCM, my traps, that was actually pulling my head back into the left because it
Mhm.
was so overactive. And I would get knots. I would get migraines from it. I would do soft tissue work, like I've tried
Mhm.
dry needling. And those were all just band aids because I wasn't fixing that, like we were saying, upstream, that
Mhm.
the root cause essentially. So
Right.
whenever there's chronic things, and even as a chiropractor, if you have somebody coming in that's okay, it's always this like, C2 on the right that needs to be adjusted. You got to ask why. Why
Mhm.
is this always happening? Is it because of their vestibular system is pulling their head in a certain position, and then that the vertebrae basically gets stuck?
Mhm.
We have to be asking why. Why are
Mhm.
we depressed? Why are we anxious? Why, that's just nobody asks that anymore.
Right, right. Yeah.
So,
So I'm curious, as I don't know if you realize or remember that I'm an osteopathic physician, and so
uh-huh.
some crossover in our training, musculoskeletal and how everything's connected. And so I
Yeah,
wonder if you find that people ignore one side or find that they favor one side.
all the time.
Yes.
All the
I see
time.
that happening, and that might be a clue as to maybe this is a functional neurology kind of thing.
Yeah,
Or if
absolutely.
the
I had
symptoms
a
are only on one side. Obviously, there are certain symptoms that people can fake, and
mhm,
that if it's all on one side, that's a problem, because there's a certain point where it can't be all on one side. But
exactly.
and people try to malinger, but sometimes there are situations where you can have symptoms on just one side and not the other,
Mhm.
that might make it a neurological, functional neurology kind of problem. These are issues which I'm really glad that you have mentioned, is that that it doesn't show up on an MRI or a
Nope.
CT scan. These are all functional issues that are related to signaling,
Mhm.
and opening up these pathways of signaling, electrical signaling, that people don't realize you can have and not have structural damage, so to speak. And so there's a lot that can be going on without even reaching that point of actually having structural damage.
Mhm.
So, so I'm glad you're talking about that, because sometimes, at least the conventional world tends to look at things not on a spectrum of symptoms, but as black and white. You either have
Yeah.
it or you don't. And if you don't have it, it must be all in your head. So,
Yeah. No, seriously, I talked to so many people that they're like, doctor had no idea what was going on with me. So they sent me to a psychiatric referral. And I'm like, it's not a mental issue. It's literally a function issue.
Yeah.
And they just don't know how to test for it. They might not know that this kind of testing exists.
Right.
And, which that's why I'm trying to educate so many people with this, on social
Exactly.
media,
Exactly. And it's
because they're
kind
not crazy.
I think it's hard for people to quite understand because even in the conventional world, the word functional
Mhm.
means, oh, it must be in your head.
Uh-huh.
You know, which is crazy.
Yeah.
But I like to explain to people that it's a problem in the software as
Hmm.
opposed to the hardware. So
Yeah.
a structural problem would be a hardware, like your microchip is just smashed.
Hmm.
Whereas the software is more like you got water in it, now it's dry, but it's not functioning properly, you know,
Exactly. Yeah.
that kind of thing. So, yeah. So, talk about your brain balance system and how it's tied to emotional regulation. You mentioned the amygdala,
Hmm.
and the amygdala is a part of the brain, just so people know that the amygdala is a part of the brain that protects you and in terms of fight flight. It's like it's the thing that turns on and really reacts, probably sometimes overreacts, right?
Yeah.
To situations, and it can be aggressive, it can be extremely emotional, and sometimes it gets stuck there and reacts repetitively. And so we teach our patients about vagal nerve stimulation and do brain retraining through different programs. And so I'm sure that some of the things that you're going to talk about is kind of overlaps with those as well.
Yeah.
And somatic therapy sounds a little bit of some of the things that you do that we do in somatic therapy as well. You mentioned, it's why talk therapy doesn't always work, right? Yeah.
Exactly. Yeah.
So it's because your body, you need to speak to the body, not to the brain or
Exactly.
the emotional part of your brain. It's really speaking to the body. So yeah, why don't you take over from there?
Yeah. Absolutely. Absolutely. And I do want to go on record that there's nothing against talk therapy. It's just not always the right solution. Just like with what I do is not always the right solution, especially if somebody has, thinking errors and, trauma and things like that.
Cognitive
That's
distortions, yeah.
exactly.
Automatic negative thoughts, yeah.
Exactly. So I don't want anybody to be like, oh, he doesn't think talk therapy is,
Yeah,
Okay. So anyways,
there's a place for everything.
absolutely. And so when it comes to these, like I said, these broken neural pathways, it doesn't have to be just the vestibular system. It could be any kind of dysfunction like that that can send these signals to the amygdala that there's some kind of danger. The amygdala can actually grow in size. It can actually what's called hypertrophy and get bigger because it's so stimulated. Okay. And I've seen some studies on people that do meditation. Their frontal lobe, which is like that, the executive decision making, that focus, that control, kind of what makes us human, that area actually grows in these people that meditate and their amygdala shrinks.
Mhm.
Okay. So it's all about that stimulus with it. So if we have these broken, dysfunctional pathways, it's going to send signals to the amygdala that can actually make it grow. And then from there, it's going to hardwire these connections. So that's like there's been some studies where they've done surgery on people like that have like back pain, for example. They've done surgeries to remove what's actually causing that back pain, and yet afterwards they still have the back pain because that pain pathway is hardwired. Okay, so same thing kind of can happen with the amygdala. If you have these pathways that are essentially hardwired, that are negatively hardwired, then that can give you, this chronic sense of, danger and this impending doom and, things like that. And the amygdala has connections to the hypothalamus, which controls all of our hormones. So it literally is we have to be asking why. Why are my hormones messed up? Is it an amygdala thing? Okay, if it's an amygdala thing, what's stimulating that so negatively? We have to look at the neural pathways and address those basically.
Right.
So
Yeah. On top
yeah.
of that, there is the hormone cortisol that
Hmm.
shoots up when you're in fight flight. And then that
Exactly.
alone can really shut down your sex hormones. So
Exactly.
connected.
And then there's the if you have a lot of adrenaline, so norepinephrine in the brain, it literally prevents you from releasing the glymphatic system as well. I've been getting really big into the glymphatic system, which
Mhm.
we have a lymphatic system, which is in our body.
Right.
And basically, that's part of our detox system. So, for all the listeners, basically, our heart pumps blood away from, like, to the body through arteries. Then it goes to something called a capillary, where it exchanges nutrients and oxygen and things like that. And then veins bring that blood back to the heart. And around those capillaries are where the lymphatic vessels are. And that's where I can pick up all these toxins, go to the lymph nodes, and then actually break it down because there's a lot of white blood cells there. Okay. So that's how that lymphatic system works. But with the veins or with the arteries, we have the heart to pump it. The lymphatic system deals with movement. So it has to actually have our muscles contracting to kind of move that lymph through the body. Then we have a glymphatic system. So lymphatic with a G in front of it. And the glymphatic system is part of our brain's detox system. And basically, we have to be in a relaxed state, specifically in delta wave sleep when we're sleeping. That's that deep sleep for the for that glymph to actually flow to the lymphatic system, which then goes into the veins to then get kind of processed through the body. So if we are stuck in fight or flight and we are not sleeping well, and just because we have too much, adrenaline going on, we're not getting that draining that's happening. So what happens is we get a lot of plaque buildup in the brain, and then we're going to get brain fog and chronic stress and like all these different like memory issues because we have so much essentially junk waste, kind of waste in that brain.
Mhm.
So it's very important to be in this relaxed state, but it's not just a matter of, don't stress about it. You got to relax. I hate that so much. You just need to relax. We
Yeah.
got to figure out why our brain is having this stress.
Right.
Okay. So that's just another tangent. Sorry about that. But it's just talking about how important it is to, figure out why you're stuck in this fight or flight because it has negative repercussions all throughout the body, not just the brain.
Right. Right.
So
Absolutely. Absolutely. It's all connected. Your head is actually attached to
absolutely.
the body.
It is. And it controls basically everything.
Right. Yeah. So can you talk more about some of the things that you address in order to cause relief of some of these symptoms?
What do you mean by address?
Like how do you
Symptoms?
assess
Or are you
somebody?
talking?
Yeah. How do you assess someone?
Yeah. So I run my tests on everybody.
Mhm.
Like I said before, is I run the test and then I apply an exercise and then I retest. That's
Right.
the biggest thing that I think people don't do is they don't do the retesting. And I do a lot of retesting because
Mhm.
I have to know, is your brain actually responding to these exercises? So basically, I always tell people if I can find it on my test, I can fix it.
Mhm.
It might take me some time because everybody's a little bit different. And sometimes they're not textbook. But if I can find it, I can fix it. And
Mhm.
so whenever I'm going over the results with people, I'm literally showing them things that we can, potentially rehab. However, if somebody was feeling, having all these different issues going on and they just aced my test basically, then I would tell them, like, I'm not the right provider for you. I don't know. It's not a brain issue at this point.
Mhm.
Um, so that's why I run through all my testing, every single visit that I do with people. I really need just about 3 visits with somebody for me to figure out their perfect exercise plan. And then
Mhm.
they go home and they continue to do these exercises about 3 to 5 times a day to kind of hardwire these pathways that we're restoring.
Mhm.
Um, then we can taper off the exercises and taper down how many times a day they do the exercises. Because, like I said earlier, the effects of the exercise last longer and longer each time that we do it until
Mhm.
it's basically hardwired.
Mhm.
So that's kind of like what I need is those 3 days for somebody to do all this testing. We figure out what's going on. I'll do a glymphatic massage, which is basically a lymphatic neck and face massage to kind of clear that pathway, make sure the brain's draining properly at night, uh, fix the sleeping issues, all that kind of stuff. So that way they can rest, recover, because basically I'm just priming the brain and helping the brain work the way that it should. That's like
Mm-hmm.
the best type of medicine, is helping the body work the way that it's supposed to work,
Right, right,
not trying to fight against it, basically.
right. And signaling
So,
appropriately, in a safe way.
mhm.
Like, yes, we are safe. We don't
Yes,
need to be in fight flight anymore.
exactly.
Would you be willing to talk about a case that you had maybe recently? It's just to give an idea of
Yeah.
like what types of conditions. And you, before you even do that, so you mentioned people have to see you for 3 days. Is
Mhm.
that 3 days in a row?
If they're out of state, I do 3 days in a row. If they're in state, I separate it just a little bit. I'll do those 3 visits usually a week to a week and a half apart.
Uh-huh.
So that way they can kind of sleep on the exercises a little bit like that.
Mm-hmm.
Um, but out of state patients, I see for 3 days. Usually it's about an hour to an hour and a half, sometimes 2 hours, just depending on how much the person needs. And I just charge one flat rate. I don't, if somebody needs more care, why
Mm-hmm.
should they have to pay more? I hate
Right,
that.
right,
So
right.
I just do, the kind of flat fee for what it's going to cost, basically. But yeah, so 3 days in a row,
Mm-hmm.
or I like to separate it. And then, especially with my local people that can come back and check in, I
Mm-hmm.
like them to come check in every so often and make sure that we're still progressing in the right path.
Mm-hmm. And how
So,
long, on average, how long does it take for people to recover?
uh, really depends on what is going on with
Right.
them. For
Mm-hmm.
some reason, dizziness is one of the fastest things. I had somebody that was just recently flew out from Florida,
Mm-hmm.
and she was so dizzy and visually stimulated, just couldn't like really look out the window when she was driving in a car, things like that. And on day two, they went up to Park City because they wanted to kind of explore Utah while they were out here. They went up to Park City, which is kind of like, to get there, you have to go through like these kind of windy roads. And her husband was just like, oh gosh, this is going to make her so sick.
Mm-hmm.
And literally, she's looking out the window, taking pictures, like she's good. I've had some other people that literally just one visit for dizziness and it's never come back. It
Mm-hmm.
just depends, like, on the person. Because I've had some other people that like the Malday Barkman syndrome. That one's taken a little bit longer, even though that is a dizzy case. There's a lot of different things going on.
Mm-hmm.
Um, but yeah, I have a patient that has MS, and we're finally getting somewhere. I started working with her, I think, in February.
Mm-hmm.
And now we're finally making headway with things, which is awesome. But it really just depends on what's going on. One of my fastest improving patients was 78 years old.
Mm-hmm.
78 years old, but he was so diligent with his exercises. It
Mm-hmm.
was amazing. Like he's an ex NFL referee. He was just like very like competitive, and just like, you know, if he wasn't good at something, he was determined to be good at it.
Right.
And so he was, and honestly, it showed with his brain. His improvements were so much better than I've seen with even some 22-year-olds that I have.
Mm-hmm.
So,
Great.
but yeah.
Great. Yeah. So I'm trying to think of, we have a list of things to talk about. And is there something that we haven't discussed that would be really important for the audience to know about it? We talked about the vestibular dysfunction and how it can
Mhm.
mimic or contribute to depression, but maybe more specifically, the postural system and gravity perception. I know you talked a little bit about that, but I didn't know if you
Mhm.
had more to say about it.
Um, Yeah, basically, like I was saying, the vestibular system can control our posture. So whenever whenever people are just like, oh, don't slouch, things like that, or like your head's too forward, we got to ask why.
Right.
Why are we doing this? It
Right.
could be because, let's say there's an overactive posterior canal. Okay,
Mm-hmm.
if there's an overactive posterior canal, we do not want to fall backwards.
Right.
Okay. Any little like kind of tilting of the head like this is going to feel like we jerked our head back. And
Mm.
so And that's scary. We don't have eyes in the back of our head. Our arms can barely move that way. We do not like falling backwards.
Right.
There's an area of the brain that gets stimulated with that called a tactile response, or like a startle response, that
Hmm.
can then give us like that anxiety. Like if you lean back in a chair and then it kind of like falls back for a second and you're like, oh, and you kind of get like that jolt.
Right.
That's that same thing that's happening. So the if we have like an overactive like posterior canal, for example, we're
Hmm.
gonna try to avoid that. And what are we gonna do to try to avoid that? We're gonna pitch ourselves forward
Mm.
because that's safe. So people that have this kind of posture, we got to look at their vestibular system and see, why are they doing this? Could
Mm.
it be structural, like Schwarman's, or something like that? Like it could be absolutely something like that.
Hmm. Hmm.
But we also got to look at the vestibular system, especially if we rule out everything else.
Right. Right.
Um, yeah. But one of the things that I want to talk about real quick is the vestibular ocular reflex.
Hmm.
So so we have something called the vestibular ocular reflex. So our vestibular system, like we've been talking about,
Hmm.
ocular meaning eye, reflex. Okay. So if I look at you and I move my head to the right, my eyes in my socket to maintain that visual fixation go to the left.
Hmm.
Same thing. If I move my head to the left, my eyes go to the right. So it's basically moving my eyes in the opposite direction of this head rotation. Okay.
Hmm. Hmm.
So in darkness on my VNG test, if I see the eyes drifting down, it's the same thing as me tilting my head back.
Mm.
Okay. And remember, I was saying that that can create this startle response. So even though you're not actually moving backwards, your brain is perceiving that you're falling backwards, which can then lead to anxiety and depression and all these kind of things like
Right.
that.
Right.
Usually, whenever I see an updrift, the symptoms with that one is more so like disassociation.
Mm.
For whatever reason, that one I'm not really sure why that's the common symptom with that, but it's kind of like just they feel like they're in a dream, like nothing feels real to them when their eyes have like an updrift.
Hmm.
And then the other thing on my testing as well is I do the test that shows it the most is pursuits vertical. So basically, we're wearing the headset. There's a dot in the screen that's going slowly up and down, and I
Hmm.
look at how many movements left and right are there.
Hmm.
Okay, so whenever we're tracking up and down, we shouldn't have any excess movements left and right. That excess movements left and right, that uses up ATP as the energy, and dopamine as well as serotonin helps modulate those movements. So
Hmm.
we could be actually robbing our brain of these feel good neurotransmitters just because our eyes aren't moving properly.
Right.
Okay, but then why are our eyes not moving properly? Is it a vestibular issue? Because, like I said, with the VOR, it has so much control over our eye movements. Is
Right.
it a cerebellum issue? Is it a brainstem issue, a frontal lobe issue, parietal lobe? Like, where is the issue?
Right.
So, a lot of times, my grandpa actually passed away from Parkinson's, and I wish I could have seen his eye movements before to see, okay, was it a lack of dopamine production issue, or were his eye movements over years and years and years robbing him of all these, feel good neurotransmitters and energy and things like that, that then led to Parkinson's? Now, I
Right.
don't know. That's kind of a theory of mine. Um, but all I know is that excess movement like that is
Right.
just causing way more stress on the brain. And so, like when I did my first test, I had 63 movements left and right on a 20-second or 45-second test. We
Wow.
should have maybe less than five. But
Wow.
then I was able to get it down to 10 the last time that I checked, which was a few weeks ago.
Uh-huh.
So it's you can fix it as long as you can stimulate the right area of the brain, and as
Right.
long as you know to stimulate that right area of the brain.
Right. Right. Yeah.
So
And there's no way of knowing this unless you do this testing. Sounds
that's
like.
the hard part. That's the hard part. I get so many people on Instagram that literally message me and they're just like, "Hey, do you have an exercise for memory or for brain fog or for
Right.
all these different things?"
Right.
And it's hard because I'm like, that's a symptom. I don't chase symptoms. I have to know what's causing, the issues.
Yeah.
And so that is the downside is I have to do an exam because this has to be so specific. Like
Mm.
literally, I just did with a patient today. She had a drift to the right. Okay. So in darkness, it was a drift to the right. It's a new drift because we fixed all the other things. And now this little drift that was probably there before is now uninhibited. And so it can literally just start showing itself. And
Right.
so did a few different exercises. I was like, okay, it's not a canal issue. It's not this. So then we tried a utricle issue. So I translated her in a chair, meaning I literally just pulled her across my office. She had a laser because we need that visual fixation on a target. Okay. So that way it's a representation of what our head is doing. And I tried translating her to the right and to the left. Left was better. I was like, okay, that makes sense. We're stimulating that left side. And then I tried a right cerebellum. So I did a right figure eight with her arm. And then I tried a left figure eight. The right figure eight was better. So it's literally so specific with how you have to be, because the left figure eight made her worse. Even though we went to the left, adding in that left figure eight literally made her test so much worse. But the effects of it only last for a few minutes. So it's not a big deal. But it lets me know also, okay, we need that right figure eight and that left translation. So that's the only downside, is I do have to do that exam in person, but then I can figure out exactly what your brain needs to get you better. Because one of the examples that I like to give people is, if you train your biceps, for example, you could do dumbbell curls, you could do barbell curls, you could do preacher curls, you could do cable curls, you can do curls behind the head. Everything is literally working the biceps. Okay. But how does your body need that stimulus? It's the same thing. I have so many different exercises for the same kind of pathways, but how is your brain going to be the most receptive to it? And that's why I got to apply these tests. I might throw in a jaw figure eight with it to get that midline cerebellum, in addition to this vestibular type stuff to help reintegrate that. We just don't know. Sometimes that combining those two is too taxing on your brain and we have to do it separate. That's okay. But I have to know, I have to do the testing. So.
Right. So if someone were to see you for 3 days in a row, like if they flew out to see you and went back home, when would they have to see you again? Or would the rest of the time be like virtual visits?
So I would like them to come back about 4 months just for a quick little check-in. So even if they can do fly in, I see them that day, I see them the next day just to make sure, and then they fly out that day, just one night back in Utah. That's preferred. And my check-ins are virtually very inexpensive. So literally it's just, I need to know that we're trending in the right direction, because the patient feeling better is literally my ultimate goal. And I will do everything that I can. And I think people see that too. They see that I'm literally going above and beyond and spending the time with the patient. That's something that, like, I don't know how you practice, but so many doctors spend 6 minutes with a patient, and that's normal. And I get people that are just like, thank you so much for taking the time and like having this one-on-one and actually listening to me. So,
I agree with you. My visits are 2 to 2.5 hours, sometimes 3, depending on how complicated they are.
Love it.
It's definitely gathering a lot of information and looking for root causes is really important. So
absolutely.
And there are a lot of things that affect the brain upstream, and so but you are seeing how it's on a sounds like a brain basis signaling issue more than anything else, and opening up those pathways and just almost biomechanically connecting the dots on a neurological level. I'm just thinking like of an example. So for example, sometimes, and so I feel like it's hard for people to wrap their brain around, like, what are you actually doing, right? So so there are people who have they don't necessarily have structural issues, let's say running, like their hips are off, or they get some knee pain, and they might have no problems structurally at all, but it's more of a biomechanical signaling. It's like muscle memory, so to speak, and just getting yourself back into that rhythm where you feel in alignment. It's the same kind of thing in the brain that I can think of as an example, and maybe people can understand it that way. So it's just putting it back into the proper rhythms and connecting in a flow or an alignment of sorts. So
Yeah.
that's why people say, oh, I just feel off.
Yeah.
Right? I just feel
Yep.
off. There's the sensation that they can't necessarily explain.
Hmm.
Right? So yeah, which is why, talk therapy doesn't necessarily, help with that,
For
because
that kind of stuff,
you're
no.
off, like you can't talk yourself back into alignment. It's all brain and a connection to the body in terms of signaling and
Hmm.
receiving input from the environment, from gravity, right?
Yeah,
Using
exactly.
several parts of your brain, the cerebellum, the vestibular system, your ears, your feet, even proprioception.
Proprioception, absolutely.
So it's all connected. And so, yeah. And it is a system that I think very few people know about. And even if they do know about it, they don't necessarily address it,
It's
unless it's
true.
really, really off. Like, well, I've
Yeah.
learned to do the Epley maneuver, right?
Uh-huh.
Which is really a treatment for vertigo, right?
Hmm. But
So,
then that's the other problem. Like, do we have time still?
yeah.
Yeah. That's the problem with Epley's maneuver is it's usually, I have my theories with Epley's maneuver. I think it's amazing for its time. I think there's so many better ways to do it
Mm-hmm.
and to rehab that area. But a lot of times people literally they're just like, oh, you have dizziness, let's do the Epley's maneuver. What's causing the dizziness? It
Right.
could literally be any, like I said, those 13 areas, it could
Right.
literally be any of those areas. And
Right.
so just doing an Epley's maneuver, where you're throwing, the patient's head back to move these crystals, I don't even know if it's an actual crystal issue. Like the imaging can't actually see the otoconia in the
Right.
canals. So is it an actual thing? Because I've been able to rehab, using a laser and taking them through different positions
Yeah.
where they're not feeling nauseous and about to throw up like they do with Epley's maneuver. Um, but yeah, you just have to be so specific with it.
Right.
And one of the things that I like to, like one of the analogies that I like to give people is when I'm especially addressing the vestibular system, it's kind of like playing a sport. Okay. Like if you played soccer every single day, okay, you would get better.
Mm-hmm.
Just if you played every single day, you would get better without any training, nothing like that. You would just naturally get better. However, if you had bad habits, say you only dribbled with your right foot, or your running was off or whatever, you would only rely on those things that are working, and it might make certain things a little bit worse.
Mm-hmm.
Okay. So when it comes to the vestibular training, if you did like balance training where you're standing on one foot, you're tossing a ball, things like that, you're literally working the entire system and you're only working what's actually working.
Mm-hmm.
You're not addressing what's not working.
Right.
And so that's what I do is I literally break apart your game of soccer or your vestibular system and I work on the areas that aren't working as well. And then that way, your whole game or your whole vestibular system can start functioning the way that it should.
Mm-hmm.
And then the name of the game is making your brain feel safe. Because
Mm-hmm.
once it feels safe, that's when you can actually heal. So
Right.
that's literally all I do is I figure out how can I make your brain feel safe, and that's usually by restoring these neural pathways.
Mm-hmm. Awesome.
So
Awesome. So there is hope. There's another way to address symptoms. And, everyone, if you or someone has similar issues, or we're describing something that sounds familiar, or like, I wonder if this is what's going on, reach out to Dr. Ryan. So
mhm.
there is hope through functional neurology. And I want to let you know that he is in Utah accepting patients, and you can fly out to see him. And you can find him at www.neurobalanceSolutions.com, or on Instagram and Facebook at NeuroBalance Solutions. And why don't you talk about your giving away a 3-visit treatment plan at your clinic?
Yeah. So basically, I like to give back basically. So one of the things that I want to do is for one of your listeners, if they can make it out to Utah, I will do the treatment for free. So let me just go ahead and contact me, send me an email at NeuroBalance at gmail.com, and we can talk. We can, see if it's actually something that I can help with. because I don't want you, if I don't feel confident in it, I'm not going to have you waste your time flying out to see me or anything like that. So I would love to do that for one of your listeners. So if this is something that you want to try and that you want to see if I can help with,
Mhm.
just send me an email and I will be picking one of the people that send me an email.
Awesome. Awesome. That is so generous of you. I really, really appreciate that.
Yeah.
Well,
Like I
thank you.
said, I've been here, I've suffered
Mhm.
myself, and I just want to help as many people as possible. I truly do.
Mhm.
And so, because I know what it's like. I know what it's like to suffer.
Yeah.
And I love what you're doing, and I love that you're spreading, all this information, and it's amazing. So thank you so much for having me.
Oh, thank you for being here and sharing your craft and expertise in functional neurology. I'm sure people will be really enlightened and know some more, and hopefully people will come your way. Yeah, through this
Yeah.
podcast. So thank you, thank you, thank you.